Outdoor worship will be held in front of the main sanctuary doors at 8 a.m. and 9:30 a.m. Sign-up is required using the online sign-up form. Non-members are welcome to attend. Dress is casual. You may want to bring hats, sunglasses, or umbrellas. No nursery will be provided for the service. When you arrive, head for one of the usher stations. When waiting to be seated, please stand at least 6 feet behind others. The sidewalks will be marked with 6-foot segments to indicate where to stand. Sanitize your hands at the sanitation station. Wearing a mask is required. If you don't have a mask, pick one up at this time. If you have any offering, you can place it in the bucket as you enter or as you leave. Then an usher will direct you to your assigned seating area. Attendees should bring outdoor chairs or blankets to sit in their assigned seating area. Family members will sit together as a family unit. It is important to remain in your assigned seating area to practice social distancing. Please, no hugging or handshaking. It is okay to wave and call out greetings. Bulletins can be found on the church website. Feel free to pull it up on your cell phone or to print one out before you arrive. The praise band will perform, but please just listen to their beautiful music and refrain from singing along. Please do not enter the church buildings. Bathrooms are for emergency use only. For such emergencies, worshipers must enter through the outreach room doors and use the bathrooms nearest the outreach room. At-risk members are encouraged to sign up for a parking spot. You are at risk if you meet any of the criteria listed in the outside worship fact sheet. Parking spots will be spread out in this portion of the parking lot. Ushers will direct attendees to the appropriate parking spot. Then tune into 87.7 FM to listen to the service. Please do not exit your vehicle. After the service, ushers will dismiss family units individually to allow for social distancing. Services will last for approximately 30 minutes. The service will be canceled in the event of heavy rain or inclement weather. If you display any of the following symptoms, even if you have not tested positive, you may not attend the service. Many of you have been screened for symptoms upon entrance to a physician's office, but since our service is outdoors, the session has decided that we will not screen each individual attending. However, that does not mean you shouldn't be doing your own personal symptom screening before attending our outdoor service. You should stay home if you have any of the following symptoms, and you should also speak with your family physician about these symptoms as soon as possible. The CDC lists the following symptoms: fever, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Remember that although we do want people with any of these symptoms to stay home, we are concerned about your health and urge you to carefully watch your symptoms and call your primary care physician if you have any questions. Let's talk about social distancing. Why is social distancing important? Scientists believe that COVID-19 spreads among people who are in prolonged, close contact with one another. It spreads from droplets that are formed when an infected person sneezes, coughs, talks, or sings. Droplets from their mouth or nose are launched into the air and land in the mouth, nose, or eyes of people who are nearby. Other than just staying home, social distancing remains the best way to prevent the spread of coronavirus. To practice social distancing, stay at least 6 feet from other people. Remember, some people will spread the virus before they know they are sick. Also, note the use of the word prolonged. The more closely you interact with others and the longer the interaction, the higher the risk of COVID-19 spread. Also, contact with other people in indoor spaces is riskier than in outdoor spaces, where it might be harder to keep people apart and there's less ventilation to move the infected droplets away from others. Let's talk about masks. No one likes masks. Even most physicians who work in operating rooms don't particularly like masks, but they wear masks to protect their patients from infection. Masks protect you, and especially those around you. As described earlier, the virus can spread among people interacting in close proximity. The mask serves as a barrier to prevent the droplets from an infected person entering your mouth or nose, a barrier preventing the droplets from leaving the infected person, and a barrier to prevent the droplets from entering a bystander. The CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community-based transmission. And for those who like to pull the mask down below the mouth or nose, you are not receiving any protection from the virus. It's important to understand that face masks are to be worn in addition to maintaining 6 feet social distancing. Face masks are good at slowing the spread of the virus, but do not entirely prevent the spread of the virus. Also, keep in mind the mask helps to prevent the virus from entering your nose or mouth, but not the eyes, which are not covered. Cloth face masks are recommended by the CDC in order to save the nation's supply of surgical masks and N95 masks for healthcare professionals. Washing your hands, or hand hygiene. Wash your hands often. Use soap and water if you can. If that's not possible, use hand sanitizer that contains at least 60% alcohol. Wash your hands for at least 20 seconds if using soap and water or if using hand sanitizer. Keep rubbing your hands together until the hands feel dry. Wash hands, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. And always avoid touching your face, your mouth, your nose, or your hands.
Okay, we're going to take a moment for hand hygiene right now. I know that sometimes it's hard to remember whether you actually have been rubbing your hands or washing your hands for 20 seconds, so here's a few tips. But the number one tip is to use soap and water against this virus if you can. It's the most effective, but when you're out and about, of course, you will need to use your hand hygiene with the hand sanitizer. So you have your foam, rub your hands together, get them kind of covered, and then start just like squeezing them, rubbing both sides together like this. And then there's a few other things you can do. One is going on your backs. I like to do that. Fists are good. Rub your fists. And then individual fingers. Just pull through your individual fingers. At the time you're finished by doing all of this, your hand sanitizer foam will be completely gone. It should be drying, and that's always a good indication that you've done it long enough. But even if you're doing soap and water, if you do all of those things, you should be good.
Cleaning or disinfecting surfaces. Although the likelihood of virus spread does not appear to be as significant from surfaces as from droplets in the air, we are not certain of these dangers. We do know the virus can live on some surfaces for up to many days. It's important that businesses that are open to the public disinfect surfaces that customers come into contact with often. One of the requirements our session has set for indoor surfaces is for the church to be able to obtain a reliable source of FDA-approved disinfectant cleaners. We will have more information for you at a later date.